Hi there, my name is Adina, and I am the owner of Restaure Botanicals and Restored Health Solutions. And I am glad you've taken the time to stop by today. Now, you are here more than likely because of the fact that you saw this is about bone spurs, and you are probably suffering from a lot of pain around surrounding bone spurs. Now, spurs happen in different places, and for you, it might be in your foot. It could be at your heel, it could be at your Achilles, it could be at the top end of your ankle. It could be at your shoulder. Some people get spurs at the acromion. That's where it kind of can cut into the supraspinatus and causes a rotator cuff tear. But there's also people who get calcific tendonitis at the shoulder. So that's extra calcium laydown. So if you are dealing with an active spur, and you know for sure that it's an active spur, this is not a simple process to overcome just with letting it rest. Okay. So I realized this as a therapist that there are people who are suffering from these different problems and they are not really able to get past a certain level of discomfort. Now, I am going to tell you though that you need to be in physical therapy and you really need to have a therapist that is helping you to deal with the tissues that are surrounding the area where you're having the calcification problem. Now, if you've done physical therapy already, because I've worked with patients and they've already done physical therapy and they're like, oh, I don't want to do anymore. It didn't work. I will tell you that we are so different. All of us are different. So if you have tried it before, there's no reason why you can't go again and then find someone else to work with. Because you mesh with different therapists in different ways, and we have different approaches. And sometimes what one therapist does, another one comes behind. They may do it similar. A lot of times they do it differently. And based upon their experience, they may do something different than the other therapist did with you. So do not neglect getting into physical therapy. If you have not done it at all, you absolutely need to get into physical therapy. And you have direct access nowadays. You can just go almost call an office and just say, hey, this is such and such a person, even if you have Medicare. This is my insurance. I need someone to help me with X, Y, and Z, my spur and my heel. And I would like to schedule physical therapy. You don't even have to go through a physician because of direct access here in the United States. So that's an advantage. So definitely you need to go into therapy. Now, I also need you to understand that getting spurs is a complicated process. Everyone who maybe has walked on concrete floors for 10, 12-hour shifts, everyone who has gone jogging on the concrete, they don't develop spurs. There has to be a reason why it's happening. You think so? Yeah. And so I want you to understand that getting this under control is going to be a multifactorial process. So it's not just doing the physical therapy for many of us, because the spur itself does not go away. You know that the options are cortisone injections, which I have issues with. And then sometimes they'll even talk about doing surgical repair, I have issues with that as well. You will have more pain. And again, if you don't address the reason why you got it, which is the other reason, if you don't address the reason why you got it, then you're going to end up having it again. Okay, so with all that said, what I am providing for you are two things. One is a bone spur recovery kit. Now, this kit is specifically for people who are dealing with heel spurs, shoulder spurs, something that is a little bit more superficial to the body, because it involves you using a couple of products that I formulate for this particular condition. Now, I would also say that will also help with nodules on the fingers and trigger finger. Okay, just so you know. But for those of you who are suffering from the spurs, I have two products. You're not going to be able to see this very well. I'll have to include you'll see it when you go to the site, but there is the, oh my, there is the Depain. I apologize. And this one I like people to use for pain in the muscle tissue. And then there is the DeOssi, which is specifically for the, oh, I feel so badly, specifically for the spur itself. So this is kind of like you put the Depain on to deal with a lot of the tissue, a lot of the pain area that you're having. And then the DeOssi is where you would apply that specifically to the area where you know you have the spurring. So you will get 2 jars of those, 2 1-ounce jars of those. Now that is something that you apply directly, but I will tell you that typically you have a lot of other changes that have taken place in the tissue around the area where you have developed this stenosis or spurring problem. And so I include also an action guide. And with this guide, it's going to walk you through some steps for you to take in order to improve the circulation in the area and to do other things to calm down inflammation in general. Now, I have this kind of as your starter. This is something to kind of get you going, get you to really realize that you can do something to control this and that there is some hope other than surgery, and that you don't have to deal with this for the rest of your days. Now, I say that understanding that you have to make the corrections that are creating this problem, and that's kind of the educational component. And I wrestled a lot with, you know, which one do I start with? Teaching you about why you got the issue in the first place, or do I provide for something for you to start getting relief? Now, I understand that there are going to be people who have gone through the therapy. They actually have maxed things out to the point that they have really resolved as much as they can resolve, but they still have the spur. So if they get a hold of my products, they're actually going to find results will happen, you know, in a reasonable time. Now, what's a reasonable time? Probably 8 weeks, okay, 6 to 8 weeks. But if you're someone who has a lot of other tissue issues, then it's going to take longer than that. And just be fair. Your problem did not start, if you're sitting here listening to this, your problem did not start 6 weeks ago. So it's not fair for you to really think that everything's going to be hunky-dory within that same time frame, because usually there's a lot of other changes, especially if you've had pain that's making you guard the area. So just to be fair, you have to be patient. You have to be patient with those things that are natural, because my whole premise is I want people to learn how to cooperate with the body's healing mechanisms. And a lot of times we don't know how to do that. So part of you learning how to overcome what it is that you're dealing with, the spurring, is for you to be able to get support even after you get the product. So I'm not satisfied with just giving you this product or selling you this product and you go get it, put it on, and like I said, I know some of you are going to use it and you're going to be fine, and I won't hear from you again until it comes back. No. But there are other people who are going to be a little bit savvy about, I've got to make sure I don't have this problem again, because you see how excruciating it can be. So for those of you who are going to be open to learning about your body so that you can prevent this and so that you can fully recover, then I'm going to be having a link where you can actually come in and join a community. And in this community, I offer ongoing support for those who are dealing with musculoskeletal issues. So it is a membership site, but it's there because I want people to ask questions. And so if you get the kit, you get the products, and you do have questions, I want you to have a place where you can engage. I don't want you really necessarily to deal with, you know, customer service, and I want you to feel like you have a person behind the product. Okay, so that's where things are a little different with me. So all that said, if you are interested in getting a kit for you to start on this journey, you are welcome to click the link below and to see what you can do to try the product. And then I will say, for those of you who may have clicked this thinking, well, she talked about heel spurs, or what about stenosis and arthritis? Well, those are other issues that have to do with the calcification problem as well, and those will be addressed as well. I do have products that I would recommend that you use for that. So just stay tuned. I'm really trying to work on getting things out as I can tolerate doing a video. So thank you for your time, and I look forward to working with you and helping you with your challenges.